Hi, everyone. So I'm Dr. Jenny Wong. I work in private practice with a focus on specialty contact lenses, and I am also a clinical consultant at Ovitz. I feel really honored to introduce this company and share with you guys their pioneering technology and what it can do for your patients and your practice. Okay, so at Ovitz, we are the first innovators that can take aberrometry data of your patient's eyes and integrate it into a scleral lens that can actually be worn. So we are the world's first automated and streamlined solution to correct higher order aberrations. Before Ovitz, many doctors had, potentially one or more aberrometers while they were exploring the HOA correction space, and eventually found that the Ovitz system is the only thing that's made for a clinic and effectively works. Let me play this short recording of a conversation between two key opinion leaders in the specialty lens space about their past experience with HOA corrections during a private Ovitz educational webinar. So let me get that going.
I've been interested in this topic for a bunch of years and trying to work on the aberrometers. In those days, what I would do is the output from my OPD, and there it was, and I'd look at that and go, what? And I would send this off to the two different labs. Here was first put the lens on her eye, and you can still, there's still all these aberrations in there. And then, lo and behold, here comes this guy from South Korea and said, try this stuff. And then you can see we start reducing things as we started using the Ovitz and the X-Wave. And she's now getting each step, she's going, wow, this is getting better and better, and happier and happier. Technology has come a long ways, and it's just wonderful to see.
I gotta tell you, same exact experience, worked with people on this for years. And I had one case, I don't know how many cases we did that work. They're all going, oh, we do HOAs. The reality is the Ovitz is the only one that I've ever used that actually works. And it works every time.
I've been interested in this topic.
It's going to repeat itself. So that is up on the internet if you guys want to go check that out. So the Ovitz X-Wave scans the entire visual system and provides a comprehensive analysis of the HOAs that are present. This data is automatically processed, and an HOA optic is designed and then sent to the lab for manufacturing. In our design process, each case is very personalized and designed specifically with that patient in mind. So we consider things like patient age, their health history, stability of the lens, the wavefront pattern, and we try to maximize the most effective outcome for these individuals. Another beauty of the Ovitz X-Wave system is being able to adjust the design. In 50 to 60% of the cases, design adjustments might be necessary after the first HOA lens is made, and that could be because of a couple of reasons. But the Ovitz provides tweaks based on the analysis, and without this capability, only sphere and SIL adjustments or even reverting back to the non-HOA lenses are the only options left. We try to make this process as simple and as easy to use, and that's a big focus of ours and will continue to be. So let me show you what our device looks like. So focusing on higher order aberration corrections, we do also include decentered multifocals, extended depth of focus multifocals as well. And so now I want to show you our current interface and point out some notable features of our device as well. So after performing aberrometry data, our system produces a wavefront map of the HOA patterns of your patient's visual system. So this is a great tool for patient education and explaining to them why they may still notice glare and double vision or other visual disturbances, no matter what you spin in their proctor or demo with loose lenses. We've heard from many doctors that simply showing their patients this map helps them understand what is going on with their eyes. I think even some doctors initially use this just for HOA corrections, but use this instrument as a routine scan to help identify patients that may have not mentioned complaints of glare in the past, but exhibit high amounts of RMS. And that sometimes triggers that a discussion to have with these patients to be able to provide them more care. So as a practitioner, you can decide how involved you want to be with understanding the HOA corrections as well. I know some doctors don't want to know anything about it. Some really want to be involved. So our system provides a breakdown of the magnitude and direction of each of the HOAs for how you want to integrate this knowledge into your diagnosis, treatment, or care. And this is a table showing that. Give me 1 second. Okay, and then this is a plot where you can visualize that data and also use it to help educate your patients. So on this side here, I'm not sure you can see the mouse, but on the left-hand side, there is an HOA RMS. That is the combined magnitude of the HOAs present. All this information can help guide your treatment and care and decide who are good candidates for this technology. Oh, there you go. All right. So this next tool is a visual simulation of the 2020 letter E and what your patients may be experiencing with their severity of HOA RMS. This simulation is mathematically rendered, but we can also adjust the simulation based on different pupil sizes. And the important thing of that is because the magnitude of HOAs are pupil dependent. You know, the larger the pupils tend to experience more of the negative HOA effects, like bare at night versus during the daytime. This is also very important how we interpret the HOA severity. So with our system, we have the ability to adjust the pupil diameter to simulate what it could look like during photopic conditions or even scotopic conditions. I think in general, this is a really great patient education tool. And I think this is really validating for those patients to know that their doctor really understands and can also visualize what they have been experiencing for so long. So our data can be easily submitted for lens order with a click of a button. Comments and notes can be added as well. And you can also directly email other notes or more details to our consultation team as well, if that's how you prefer. So our system includes a comparison feature of the HOAs before and after correction. So as another tool for education, patients can see what changes have occurred in their visual system. This right here is the wavefront map, which demonstrates the overall pattern before the correction and after the HOA correction. It's so much smoother, less of that draconic appearance. And then you can also break down the HOAs individually as well, which you can use to show which specific HOAs have improved. I think this is really great to show patients, you know, what has changed, and it's a good something nice to kind of review with your patients. I think there was a funny story where one of our colleagues had fit a patient. Patient didn't really notice a huge visual difference subjectively. They might have, you know, some sloppy vision. That's okay. After seeing the changes and the improvement in their HOAs, they really felt validated and just happier and noticed that there was a difference. So right now, the lenses that are, the scleral lenses that are compatible with the HOA correction are these right over here. So hopefully you're already fitting one of them, or you're interested in learning to fit some of these designs. I think these are incredible companies. They all have really great support and consultants to work with and can definitely help you ease into the HOA scleral lens fitting process. So this is currently what is available on the market, but there are definitely more to come. Okay, so in addition, I do want to mention the community around Ovitz and HOA corrections. We do have a private Facebook group where doctors and patients can interact. This community is where a lot of colleagues share what works for them and just, you know, to be able to share and update each other with the newest information and kind of help each other grow. And I think Jenna also posted the link and the name of the Facebook group in the chat as well. All right, so before we open up for discussions, I do want to share with you guys some patient testimonials on their experience with Ovitz HOA corrections and their scleral lenses.
How are your new lenses?
My lenses are great. Been through a pretty long experience in kind of figuring out what the best fit is. And after doing several different trials and changes, with the Gaudi and Ovitz HOA technology that Dr. Leonard recommended, it fit great. I wear them probably 14, 15 hours a day, completely forget I even have them on. I literally can't imagine life without these specific fits and these specific contacts. So really appreciate what the office has done.
Oh, congrats.
Thank you so much.
Of course. How are your new lenses?
Just one more, you guys.
Kapashnik, and this young man has keratoconus. We had him with a number of scleral lens designs, but with all the lenses that we gave him, he still noticed some glare and halos and double vision. We fit him with a new type of scleral lens that corrects higher order aberrations, and he's going to talk.
Yeah. So, like Dr. Bostic said, I definitely was seeing double a lot with all the lenses that fitted with me. But then with these new lenses, I feel like vision clarity is way, way better than I've had before. And I'm just excited to wear them out the wall.
It's always so sweet to hear those stories. All right. So I will have Nick or Felix get into this promotion that we have going on.
Yeah, for sure. If we are offering a show special here, just like you see here on this slide, we will offer a 1 month of rent free. You get to try out our X-Wave system for a month, and there's no cancellation penalty fee or at all, and we're happy to offer a free HOA lenses so that you can try it on your HOA patient. And you can send us an email at info@ovitz.us. You see here on the bottom, and tell us that you were at this OU webinar, and we are happy to assist you with the next steps.
All right. Thank you, Felix.